Monkeypox is now in the United States, Europe, and Australia. And the bad thing is people have an overall higher chance of dying from monkeypox when compared to other viruses like COVID-19. Also, a major concern is monkeypox deaths are seen in young children mostly. So it's incredibly important to understand what monkeypox is, the symptoms of monkeypox, and how you can protect your family. That's why today I'm going to answer the question, what is monkeypox? And then I'm going to let you know everything you need to know about the monkeypox virus. So let's dive in. Welcome back, YouTube family. If you're new to my channel, I focus on making complex medical issues easier to understand. Make sure you stay to the very end because I'm going to talk about the best ways to protect your family and yourself from the monkeypox virus. Moving on, there are two distinct strains of the monkeypox virus. The first one is the Central African strain. This strain is much more severe and can actually cause around a 10% fatality rate in some people. The other strain is the West African strain. This strain is less severe than the Central African strain, but it still has a fatality rate of around 1 to 3%, which is still high. Again, the monkeypox virus is primarily seen in Africa, in countries like the Democratic Republic of Congo, and it's endemic in West and Central Africa. That's why the strains are named after those regions. So if you live in the United States or different countries in Europe, it's incredibly odd to see a case of monkeypox. That's why this recent outbreak is incredibly odd. One of the reasons why monkeypox is so rare is because it's a zoonotic infection. A zoonotic infection, for example, is when an animal is infected with monkeypox and gives it to a human. That's actually the most common way people get infected with monkeypox. When people think about monkeypox, they think that these monkeys are running around, infecting people, wreaking havoc, and causing chaos. But the virus can be spread through various animals like rats, rabbits, squirrels, monkeys of course, and other animals. Oddly enough, the United States had a monkeypox outbreak of around 70 cases back in 2003. And guess where the source came from? They came from prairie dogs. People in the United States decided to buy some prairie dogs as pets, but what they didn't know is these prairie dogs were infected with the monkeypox virus. And how the prairie dogs got the monkeypox virus is from African rodents. Then the prairie dogs ended up spreading the monkeypox virus to other humans, thus forming an outbreak. It's crazy. So some people may be asking, how did they get infected from the prairie dogs? And the answer is a majority of the people who were infected during that outbreak admitted to either petting, getting scratched, or getting bitten by an infected animal. The really good news is human-to-human transmission is very rare. On the other hand, we're really concerned about the at-risk groups. The at-risk groups are those individuals who have a higher chance of death if infected with the monkeypox virus. Those people are immunocompromised people, young children, which is really scary for a lot of parents, and also women who are pregnant have a higher chance of miscarriage if they're infected with the monkeypox virus. On the other hand, many children in the United States, in Europe, in Australia are overall healthy, so they're able to fight off this infection naturally. But malnourished children, children in low-income countries, children who are immunocompromised may not have the ability to fight off this infection naturally, and they could ultimately die from this. So how do you get monkeypox? You could potentially get monkeypox from being exposed to infected large respiratory droplets, infected body fluids like blood, or you can get in contact with a monkeypox lesion and get it that way as well. One of the most important things you need to know are the symptoms. So what are the symptoms of monkeypox? Usually people present first with a fever, they can have a headache, body aches, chills, and also lymph node swelling. And fun fact, smallpox looks very similar to monkeypox, but the big difference is many people, actually most people with smallpox don't have any lymph node swelling. After the fever develops, most people develop the classic rash around 1 to several days later. It first starts on the face and then moves to the rest of the body. The classic rash usually starts off with these pigment changes we call macules, then they turn into these papules, which are these little bumps. Then they turn into vesicles, which are these fluid-filled bumps. Then they turn into pustules, and then they rupture and scab over. and the scabbing takes around 2 to 3 weeks, and all the symptoms last around 2 to 4 weeks. But I'm gonna be real honest with you all, you don't want monkeypox because this classic rash frequently scars. This scarring can cause disfigurement on a lot of people. So imagine a child who develop monkeypox and have all these different lesions and they scar over. This can play a huge mental toll on this child or even an adult, so you don't want monkeypox. By the way, if you're getting any benefit from this video, please give me a like and subscribe below. Also, I do these videos for you guys, so if you have any questions or concerns or issues, or if you want me to make a video on something, leave a comment below and I'll definitely try to get back to you. Next, how do we diagnose monkeypox? We diagnose monkeypox by doing a good physical exam, looking at their signs, looking at their symptoms, and making a diagnosis. But we always want to confirm this with a test, like an ELISA test, a PCR test, or another test that is available. So if you're concerned about monkeypox, go see your provider. They'll either do a nasopharyngeal swab, or they'll swab the lesion, or they'll simply do a blood test. What is the treatment of monkeypox? The treatment of monkeypox is simply supportive care, meaning we make sure that they're hydrating well, they're eating well, resting and treating their symptoms, and most patients recover. In severe cases, some patients may need antivirals or be admitted to the ICU, but it all depends on the particular patient. So how do you prevent getting monkeypox? Well, prior vaccination with the smallpox vaccine is proven to be beneficial against monkeypox. Many people around the 1960s and below received the smallpox vaccine. This led to the elimination of smallpox worldwide. Fun fact, some countries still have the smallpox virus stored in a lab, and it's a big concern that these countries may use them as a biological agent to kill people. So that's why a lot of militaries vaccinate their personnel before they deploy with the smallpox vaccine to protect them against any dangers. And I know what you may be thinking. You may be thinking, we're talking about the monkeypox virus, we're not talking about smallpox, but they're very similar, and that's why the smallpox vaccine works on the monkeypox virus. If you're not vaccinated with the smallpox vaccine, like most people aren't, it's very important to practice good infection control practices. Make sure you're washing your hands, making sure you're staying away from sick individuals. If you see a weird rash, stay away from that person. If you're sick, make sure you're wearing a good surgical mask or N95 mask to protect others. Additionally, this may be the most important thing, but make sure you're taking care of yourself. Make sure you're hydrating really well. Make sure you're eating a healthy, balanced diet. Make sure you're getting plenty of exercise. Make sure if you're having a lot of stress, practice good stress management techniques. And one of the most important things is getting plenty of rest. The good news is monkeypox is not known to be very contagious compared to smallpox or COVID. Also, fun fact, some companies are trying to develop a monkeypox vaccine, but as you all may know, this takes a long time to develop. Hopefully monkeypox spontaneously resolves and we don't have any more cases and we don't have anything to worry about. But if not, make sure you're taking care of yourselves. Well, that wraps up today's video on monkeypox. Thanks for watching. If you want to support my channel, please give a big old like and subscribe below. Otherwise, take care.